Hi, I'm Dr. David Hill, and today we're going to talk about how do I stop diarrhea for a baby. Well, to talk about that, we have to define what diarrhea is in a baby. This varies by the baby's age. A newborn infant is probably going to be stooling at least 2, 3, 4, 5, even 10 times a day in the first week of life or so, especially if that infant is nursing or breastfeeding. It is totally normal for newborns to stool every single time they feed. That's called the gastrocolic reflex. In other words, something comes into the stomach and the colon says, I better make room for what's coming in. That stool is likely to be kind of watery. It may look like it has little seeds in it. It's usually yellow or green in color. And so if somebody calls and says, hey, I've got a 2-week-old infant and they're having watery stools every time I feed them, I say, great, that's exactly what they're supposed to be doing. That's probably not diarrhea. On the other hand, if there's blood in the stool, I get a little more concerned. That could be the sign of an infection or a food allergy that needs to be addressed. Now, as that child begins taking solid foods, or in babies who are formula fed, they get up a little on in age, maybe 4 months, 6 months, I do expect those stools to slow down a little bit and form up a little bit. So if you've got a child in that age range, an infant who has developed sort of a stable stooling pattern, they're not having a watery stool every time they feed anymore, and they have an acute change in their stools, I begin to get concerned about it. Now, even in those children, to have 4 or 5 stools a day is not unusual, but if you're getting up to 8 or 10 stools a day, I kind of get more interested in it, especially if it's accompanied by fever, vomiting, poor feeding, apparent abdominal pain. We're going to want to know what's going on. Now, the question we're addressing today is, how do I stop the diarrhea? The most important thing to not do is to stop giving the child fluids. There's an old wives' tale out there, well, you need to put them on rest, just stop putting stuff in their stomach, or people say everything I give them goes right through them, so I stop giving them stuff. No, 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 no. They may get dehydrated, so you want to keep the fluids going in. But what fluid is very important? If you're nursing, don't stop nursing. Breast milk is good for this stuff. If you're giving a formula, you may take 8 hours or 12 hours off the formula to go to a rehydration solution, something like Pedialyte, Enfalite, or K-electrolyte. These solutions have balanced mixtures of salt and sugar so that they replenish the fluid in the body without contributing to diarrhea. Now, a fluid that you don't want to give is a fruit juice. Fruit juices will actually bring more sugar into the intestine. That brings more water into the stool and may make the diarrhea worse. Water, on the other hand, would be okay for a short period of time or for mild diarrhea. Now, there may be some role in using dietary supplements like lactobacillus. We do know that lactobacillus supplements may shorten the duration of diarrhea in infants when it's due to a viral infection or to recent antibiotic use. In fact, those of us who prescribe amoxicillin clavulanic acid, also known as Augmentin, will frequently give lactobacillus along with that antibiotic to try and keep babies from having diarrhea, which they often do have when they're taking this stuff. Most importantly, you want to know why this baby is having diarrhea. So call his or her doctor's office, talk to the people there, and see if they're concerned about your baby, if they think the baby might need stool studies or an exam. Don't just assume that this is a virus, because some of these diarrheal illnesses can be severe, dangerous, or life-threatening. Talking about how to stop your baby from having diarrhea, I'm Dr. David Hill.